Hi all, we're here to present two theory, the comparison of Rosemary Rizzo Parses' theory in human becoming and Madeline Leninger's theory in culture care. We are the group 4 and we have Shamsi Kadami Barini, Christopher Gunakaw, Mary Del Ibasan, myself Annalisa Licuanan, and interpreter. We're here to compare Madeline Leninger's culture care theory of diversity and universality versus Rosemary Rizzo Parses' human becoming theory. I would like to give you a brief background of these two theories. Madeline Leninger, who is she? She was born on July 13, 1925 in Sutton, Nebraska, and she lived on a farm with her sibling. She is the first professional nurse with graduate preparation in nursing to hold a PhD in cultural and social anthropology. She obtained a bachelor's degree in biological science with a minor in philosophy and humanistic studies in 1950. She was the founder of transcultural nursing and a leader in transcultural nursing and human care theory. And she developed the concept of transcultural nursing and the ethno-nursing research model. She favors ethno-methods as the desired and meaningful approach to study care because these methods are directed toward discovering the people's truth, views, beliefs, and patterned life ways. And these other theories that we compared with is Rosemary Rizzo Parse. Dr. Parse is a graduate of Duquesne University in Pittsburgh. She published her theory of nursing, Man Living Health in 1981. She changed the name to Theory of Human Becoming in 1992. She published 8 books and hundreds of articles about human becoming theory. She was the president of Discover International Incorporation, an organization to promote excellence in nursing science. Dr. Parse is a fellow in the American Academy of Nursing. Our next presenter would be Shamsi Kadami Barini.
Hello everyone. Now I'm gonna explain about the first theory. Is about transcultural theory. At first, about the philosophical underpinning is related to transcultural nursing, ethno-nursing, cultural congruent care, health, and human beings, and society and environment, and cultural care diversity. At first, transcultural nursing is a theory-based humanistic discipline and designed to serve individual, organization, communities, and society. Human care or caring is defined within the context of culture, and culturally competent care can only occur when culture care values are known and serve as the foundation of meaningful care. Transcultural nursing is a body of knowledge that helps us to provide culturally relevant care. That's from Boyle, 1999. And Dr. Leninger described her theory in this way: a substantive area of study and practice focus on comparative culture care, value, beliefs, and practice of individual or groups of similarly or different culture. Transcultural nursing's goal is to provide culture-specific and universal nursing care practice for the health and well-being. And well-being of people, or to help them face unfavorable human condition, illness, or death in culturally meaningful ways. And what is the goal of this theory? Is at first advance cultural competency of nursing and the worldwide, and to advance scholarship means use the culture teaching for nursing student and for research, and to develop strategy for advocating social change for cultural competence care. Human becoming theory, the second theory, and to understand the depth of this theory, there are three principles, and each principle has three concepts. At first is structural meaning. Structural meaning, which is basically the region show language or even remain silent, and concept is include imaging and valuing and language. The second one is configuration, rhythmical patterns, means is creating pattern in daily life, and the concept is revealing, canceling, and enabling, limiting, and connecting, spreading. And the third one is contra ascending with possibilities, means continue to change as they choose from possibilities and in our life. And the concept is the powering and the originating and transforming. Sorry. And the first theory of human becoming guide nursing in their practice to focus on quality of life as it is described and lived by Karen Orr and Melanchico in 1995. And the human becoming theory of nursing present an alternative to both the conventional medical approach and the bio-psycho-social spiritual, but still normative, of most other theories of nursing. And the human becoming theory poses quality of life from each person or own perspective as the goal of nursing practice. And thank you. And the next presentation with my friend.
Hi all, myself Inderpreet, and I am gonna discuss the strengths and the weaknesses of both the theories. So first, we're gonna discuss the strengths of this theory. The transcultural theory. Concepts and relationships are at the level of abstraction, which allows them to be applied in many different situations. And if we talk about the human becoming theory, it differentiates nursing into other disciplines, provide guidelines of the care and useful administration. It provides research methodologies, provide framework to guide inquiries to other theories like grief, hope, laughter, etc. And then if we talk about the weaknesses, like any theory, it has some advantages and some weaknesses too. So first we are going to talk about the transcultural theory. One disadvantage would be it causes a dilemma between the nurse caring the client, and sometimes some practices of our clients will lead to more health problems. And in human becoming theory, the one weakness is it does not utilize nursing care process, diagnosis, and negates to the idea that each person engaged in unique lived experiences. Next, we're going to discuss about the differences of the two theories, and my friend Mary is going to talk about that.
Hi, I am Mary, and I will talk about the key differences of the two theory. So, with Rosemary Reiser Parse, it was stated a while ago that the human becoming theory possessed quality of life from each person's own perspective as a goal of nursing process. So it means that we base our nursing practice or nursing care to our clients based on their own perspective or their own viewpoint. The second one is Madeline Leininger. Transcultural nursing is a comparative study of cultures to understand similarities and differences across human groups. So as a nurse, we are not only dealing with the illness of our clients, but we need also to consider other factors like social, emotional, spiritual. And on top of that, we need to consider their culture, beliefs, and practices in order for us to deliver the best care to them. Okay, so with human becoming theory includes totality paradigm, meaning a man is a combination of biological, psychological, sociological, and spiritual factors, and it is a unitary being on a continuous mutual interaction environment, whereas transcultural theory renders culture-specific care, and it is a means to establish a sound and defensible discipline and profession, guiding practice to meet a multicultural world. So, group mate will talk about the value and usefulness to nursing.
Hello again, my name is Christoph, and moving on with our presentation, I'm going to talk about the value and usefulness to nursing with the two theorists. For Rosemary Rizzo Parse, the Parse theory of human becoming guides nurses in their practice to focus on quality of life as it is described and lived. The ability to see patient's perspective allows nurses to be with the patient, and guide them toward desired health outcomes. It enhances understanding of human living experience and health, quality of life, and a quality to nursing process. With this theory, from what I believe it kind of like teaches nurses to become beyond more than principles and principles of what we have taught inside the class. It is, as what we call on an old school saying, a caring hands for and touching lives for nurses. For Madeline Leininger's theory, it addresses the cultural dynamics and the influence of nurses-client relationship and the nurse to its colleagues. This theory addresses not just the relationship of the nurse towards the patient culturally, but also as a guiding principle to nurses to each colleague that we need to be more sensible to other cultures in a working environment. It helps nurses to understanding and be respectful of the diversity that is often very present in nurses' patient load. Another thing would be it helps nurses to be aware of ways in which the patient's culture and faith system provide resources for their experiences with illness, suffering, and even death. With these, we became well culturally sensitive and diverse towards other cultures. That will be all. Thank you.
As a conclusion and discuss about the all of the theory, and in my idea, in the past, the nurses focus on medical symptom, disease, and treatment. But now we use all of the theory in our practice and help us to know better care to the patient.
So, if we need to conclude, we can conclude both theories like that. We can say that the nurses need to be aware of and sensitive to the cultural needs of the client. As practice of nursing today demands the nurses identify and meet the cultural needs of the diverse group and understand the social and cultural reality of the client, their family, and the community, develop expertise to implement culturally acceptable strategies to provide the nursing care, and identify and use resources acceptable to the client. As there are more differences than similarities in the practice related to the caring, therefore becoming familiar with one's culture is the utmost importance to provide the optimum care to the client. However, the research considered the past theory as the closed circle. The results are rarely quantifiable. That is, the results are difficult to compare to other research studies since there is no control group or standardized questions. The theory does not utilize the nursing process and negates the idea that each patient engages in the unique lived experience. So my friend will discuss more about the conclusion.
To add up for that conclusion, application of both theories in nursing practice depends on settings and situations. With Leininger theory, there are many benefits to nurses to use cultural knowledge of patients to treat them. Cultural knowledge is also beneficial to us nurses because it helps us to be open minded and be aware of our own cultural background in regards to working with patients from cultural diverse background, like here in Canada. Parsons' theory, which focuses on quality of life from each person's own perspective as the goal of nursing practice, sometimes is hard to apply because nurses must subscribe to this view to truly use it. Again, the theory has its own strengths and weaknesses. One weakness is that it does not utilize nursing process, not applicable to acute emergent care, and not accessible to the novice nurse. Although each nursing theory reasoning is of different way, each was aiming ideal at excellent application in nursing practice. That's all. Thank you.